I've just returned from kicking off our broadband forum over in another part of the city. Part of our initiative that we talked about in our State of the State, one dealt with broadband and one deals with improving the quality of health care in the state of Alabama. And that's what y'all are working on today. And thank you, Dr. Franks, and thank you for all the people on our task force and this organization here, which is part of our task force, and then other people that have joined in dealing with health care literacy. It's interesting. Many of us, as we go through training, as we go through our education, we learn all these big words. And we talk in those big words. As physicians, we talk to each other in almost a foreign language. No one has a clue of what we're talking about except us. But we think we're smart because we sound smart. And in the nursing field, y'all do that too. Everybody, we sound smart because we talk smart. But you know what? The average person out there has no clue of what we're talking about. And we're talking about their lives. And we're talking about what they should be doing, but we're talking to them in a language up here that they don't understand. That's just normal human nature. I think that I saw a study. This has been 5, 6, maybe 10 years ago. Time goes by so fast. I don't know how long ago it's been, but I saw a study that said at best, the most intelligent patient that you have has only a 41% compliance when it comes to taking their medications. And that's at best. So you can think of what at worst is. When you write a prescription and you tell them to take this a certain way and do it a certain way, and then, they hand out, when you go to the pharmacist, they hand out this long list of things to do and not do and things to take with it and not take with it. Patients don't pay any attention to that. Now, the pharmacists do a good job of trying to explain it to them, when they get the medication, when they have the time to do it. And sometimes we as physicians, we don't take enough time explaining it to patients. And we don't allow them sometimes to ask us in common, ordinary language, how do I do these things? Why are you doing this, doctor? Why are you doing this a certain way? Why do you have to do this surgery this way rather than what I've read about the way it normally is done or another way? So the literacy of our patients is so important. And whether or not they understand that if they're diabetic, they need their A1C level checked, or if they're hypertensive, whether or not they need to take their medications, I don't know what y'all are looking at, but I think we need education not only on the side of patients, we need education on the side of providers. Okay? We need to explain to patients in simple, common language what they need to do and why they need to do it. And the bigger words we use only complicates things, not makes it better. Makes us feel good, the patient stays sick. So I just appreciate y'all looking at this. I think this is it's just one of the areas as we're trying to help people improve their lives and maybe take control themselves of their lifestyle, take control of taking care of themselves, mothers taking care of children, individuals taking care of themselves. So, like I say, I think this literacy, it ought to go both ways. It ought to go for us as providers, and it ought to go for the patients, because we're all in this together trying to make people healthier. I'm tired of being last in this state in so many things. I love being number one in football. Roll Tide. And if you're an Auburn fan, War Eagle. And what? Oh, well, I was going to say, go Blazers. or when they come back. But they will be back. They'll be back next year. Bigger and better than ever. And so I enjoy being number one in economic development, accolades, and all those things, and being number one in football, but I'm tired of being last in quality of life issues. And we don't need to be. A lot of it has to do with poverty. I talked about poverty in my State of the State. We don't need our people being the 6th poorest state in the country. You know, we can do better. And if we all work together, we can do better. And it's not just lip service. There are things that we actually can do. And that's what I'm trying to do. And so what y'all are doing is part of that, and I thank you for that. And so let's all continue to work together to make the lives of the greatest people in the world, and that's Alabamians, make it better. So God bless y'all, and thank you for what you're doing.